please remember to have all the delegates for the declarations of the meeting with Carla. Carla, and the table on the back, that's Carla. She's raising her hand in the back room. What is your delegate? Please take advantage of this first hours of the morning we have to do this meeting today, and also we'll have the second meeting of the committee for the coalition declaration. We are lucky that another country had joined the coalition, and we hope that more countries leave this meeting with the coalition. Let's start with the agenda today. We ask you to put your phones in silence mode and other devices so that the event is not interrupted. Today, for the event, the power of multi-sectoral approaches for human capital development, this launching of the social protection pathways to nutrition study. Before I present the moderator and the speakers, I want to remind that one of the speakers will speak in English. For those who need interpretation, please go outside and get the device for the translation, please. And before that, let's watch a movie from Stephen Devereux. That is a summary of what was discussed about school feeding in the first day. Let's watch the video. I don't have the audio of the video.
Today, we face a global cost of living crisis, and the prevalence of hunger is rising, reversing a decade of progress towards SDG 2. On top of that, climate-related disasters have ravaged countries across the world in 2023, from floods and cyclones to wildfires and earthquakes. In this context of increasing uncertainty and crises, and with poor people in low-income countries most at risk during shocks,
os países de baixa renda estão em risco e sofrem com desastres, mas nós temos resposta humanitária e proteção social. A proteção social é importantíssima para o alívio das dificuldades que esses países sofrem. Em 2020, mais da metade do planeta estava desatendido com relação à proteção social. Um terço da população continua fora dessa proteção social. A proteção da proteção social é combater a fome e a pobreza. E nós temos intervenções como
as well as individual outcomes, such as nutrition status. I want to briefly focus on one of the most powerful social protection instruments, which I know is a focus of your deliberations in Brasilia, school feeding programs, because they have multi-sectoral benefits and contribute to developing human capital. In terms of the life cycle approach to social protection, school feeding provides protection to one highly vulnerable cohort, school-aged children. School feeding has two complementary theories of change. The first pathway is through food security and nutrition. Children who receive meals at school have higher overall food consumption, and this reduces their hunger and malnutrition. The second pathway is through education. The attraction of a meal at school encourages higher enrollment and attendance of learners, leading to better performance at school. Working together, the food security and education benefits significantly enhance the human capital of children, raising their prospects of escaping poverty once they leave school and enter the labor market. In Latin America and the Caribbean, school feeding has been a flagship national program for many years. reaching more than 80 million children in 2022. It is funded through national resources and increasingly uses domestic rather than imported sources of food through local procurement modalities such as homegrown school feeding. A recent cross-country analysis covering 190 million children in 14 countries confirmed that school feeding generates positive returns to investment across 4 sectors: social protection, agriculture, health and nutrition, and of course education. The social protection benefit is the immediate income transfer to the household, equivalent to the value of the food provided to the child at school. School feeding also offers a safety net during shocks and crises, which is extremely important, especially in low-income contexts. This was highlighted during COVID-19 lockdowns, when countries across the world responded by delivering variations such as take-home rations or school feeding at home while schools were closed, which protected the food security and nutrition of affected children and their families. To sum up, school feeding has always been popular across the world, but recent innovations in its design and more rigorous empirical evidence about its multi-sectoral impacts confirm its position as one of the most effective social protection instruments in the policy toolbox available to governments, because it provides an immediate benefit while simultaneously building human capital for long-term developmental impacts. Thank you very much.
Bueno, muchas gracias a Stephen por estas.
Thank you, Stephen, for your ideas and conclusions that you bring. Well, then I would like to ask Will Wiseman to be the first moderator for the first session today, that is the launch of the Social Protection Pathways to Nutrition study. Thank you, Will, for being together. And Practice Manager, Social Protection and Jobs, Latin American and Caribbean for the World Bank. Giulia, Baldi, Regional Social Protection Advisor from WFP. Also, online, Nicholas Nisbet, Fellow at the Institute of Development Studies and Professor of Global Public Policy, Nutrition and Health Equity at the University of Sussex. I don't know if we can see him. We'll see him at any moment now. Also, we have Carla Mejia, Regional Nutrition Advisor from WFP. Welcome, Carla. Rodrigo Martinez, Senior Social Advisor Officer from ACLOC. Thank you, Rodrigo. And Rui Lopez Ridaura, General Director of the National Center for Preventive Programs and Disease Control in Mexico. Welcome too. Rui, can you please? Thank you. Good morning, everybody.
Let me start by thanking colleagues from the IEB and other partners for the invitation to moderate this session. And welcome to the launch of the first regional study by WFP and partners IDS and IFPRI on social protection pathways to nutrition. We're live streaming as well this morning the launch of the report, so let me also welcome everyone who's joining us online. We're going to be doing the session, as was mentioned, in both Spanish and English. I'm going to speak in English in my opening remarks in solidarity with my British friend who is connected with us from London, who will also be presenting later on. So let me start just by saying that I think Stephen has provided a very useful framework for this session, an excellent introduction. He placed a lot of emphasis on the links between school feeding and nutrition outcomes. But I think much of what he said applies equally to other social protection interventions. And what we're going to be doing this morning in this session is kind of broadening out to consider the whole social protection space and its links to nutrition and food security. I think before we start, it's worth emphasizing again the challenges the region faces with food insecurity and malnutrition. It was spoken about quite a lot yesterday. Both structurally prior to the pandemic There were 4.8 million children under 5 who were stunted, almost 1 million who suffered from wasting, and 4 million who are overweight or obese. So that's 1 in 5 children in the region who are suffering from some form of malnutrition. But then, of course, we know that during the pandemic and following the pandemic, with the food price crisis that we've seen in the region, that burden of malnutrition has become much worse. I think Lola mentioned yesterday to a tripling of the burden in the region since 2019. So the question is then, how can governments respond to that, right? How can they meet that enormous challenge? And at the outset, of course, we're in a region where the fiscal context has worsened very, very significantly as a result of both the need for governments to spend in response to these crises, but also because of lower economic growth that has resulted because of these crises impacting the economies in the region. And so we see now that governments across the region are looking to reduce deficits and debt and consolidate levels of spending. So it's in that context that I think it's very important that every investment that governments are making in social spending is getting the maximum return possible. Governments are able to get the biggest bang for their buck that they can. And so let's get concrete. What can be done in the social protection sector to ensure that every investment is getting the maximum impact on the outcomes of interest, such as nutrition and food security? Now, the evidence that they do have an impact in general is there. Stephen, in his introduction, just alluded to that positive evidence. But I think we also need to recognize that it's somewhat mixed. To paraphrase the meta-analysis from the British Medical Journal last year that looked at this with respect to cash transfers specifically, results tend to be quite heterogeneous. Results can be small. And therefore, it's really... it points to the need to really focus in very intentionally on careful design, careful implementation, careful monitoring and evaluation to make sure that we do maximize the opportunity to see those returns from these investments. And how do we go about thinking about that is exactly what we're going to be discussing this morning. So let me give you a quick overview of this morning's session and reintroduce our panel. We're going to start with a presentation of the report by Giulia from WFP, Giulia Baldi. Then we will have Nick Nesbitt presenting as well, who will be joining us virtually. And then Carla Mejia, also from WFP, will finish out the presentation. We're then going to have a short video. We will then pass to our 2 commentators. We have Rodrigo from the Economic Commission for Latin America and the Caribbean, and then Rui from the National Center for Preventive Programs and Disease Control in Mexico. And then finally, there'll be an opportunity for questions and answers from you if there's anything you would like to ask our panel or our commentators. So with that, welcome again. And let me hand over to Giulia to start the presentation. Giulia, over to you.
Well, then I will start by saying a little bit of a history, a recap of why we got to the will to develop this study. Just to give a summary, the double challenge that the region that happened also mentioned in the session 1 yesterday, a multidimensional challenge, especially in terms of food and nutrition security, severe insecurity, pre-pandemics, and the acceleration of the double charge of malnutrition, with including the high cost of nutrition diets. It's been an obstacle to guarantee health nutrition a real health diet linked to the income and a vicious cycle, malnutrition and poverty and malnutrition. And some data showed, I'm not going to present again, they were presented already, but in reality, what's the impact? It not only has an impact on the well-being of the people of the region, but it also has an impact on the economies. And this also has been worked through studies that were done together with ECLAC on the double charge of the malnutrition. We see that the double charge of the malnutrition, the double risk, the obesity has an impact on the local economies in terms of reduction of GDP by year. It gets to 16%. From 12 to 16%, and this is through a series of impacts that has to do with impacts in health, education, and an impact on the production of the countries. So, what can we do? The social protection has an opportunity and a huge potentiality to obtain an impact. More sustainable impact on the double risk of malnutrition, and contribute to revert the challenges and the endangering that we see in the region. And then we do this question, not only relevant, but urgent, because we've seen this acceleration of this phenomena have had a risk of reduce the advancements that we managed to get in the last decades in human development. The other important aspect that we've started to develop this study is the aspect related to social protection system. They are connected to other systems. They don't work alone. The social protection system are connected to food, nutrition system, education, job generation, and health. We have to strengthen this interconnection to have a better impact. So for this, and apart from that, this interconnection among the systems has also ulterior complexity in the effect of the crisis of different types. We've seen the complexity of all the types of crises in the first session of the context. So the shocks, the climate, economic crisis, impact of COVID, among others, have also created challenges for the social protection system that has to adapt to respond to these. And at the same time, they have to guarantee this interconnection. To start with this, we noticed that there was an evidence, but we need to have an evidence where we would start. Not only evidence just to have evidence, but an evidence that could use to inform policies and programs that could contribute to drawings of policies and programs and foster dialogues in this area. And also to do that, we thought about a combination of an integrated systematic evaluation, also the conceptual benchmark to guarantee that this decision taking from the different decision makers of the region, we got into the context of the countries of the region. So this evidence combines these elements and the experience as well. We've done this effort to isolate, which try to do this academic experience to work together with the academic. Oh, sorry. Thank.
To the next slide. This is a summary of the process that we followed in more detail. So between the partnership between IFPRI, IDS and colleagues in WFP. So this shows how we moved from an initial scoping of frameworks through to searching academic databases for individual studies and evidence. Sorry, if you could just move to the next slide. So just the next slide, please. That's perfect. No, sorry, back one. Or just back one slide to the slide summary of process. Perfect, thank you. So as I said, this is the process in more detail, showing how we moved from an initial scoping of frameworks with regard to social protection and nutrition linkages, through an extensive evidence review, searching academic databases for individual studies, evaluation and other forms of evidence, to an extensive operational case study research in 4 countries, a series of stakeholder workshops, and finally the process of framework development. Next slide. So curating a disciplinary team was a really key part of the project. Too often experts in social protection and nutrition, we find ourselves working in different sectors and sometimes using quite different technical languages. But given the background Giulia outlined and Will has also spoken to, it was key to bring in different experts ranging from poverty alleviation, food security, nutrition, evidence synthesis, equity, and others. And that was at the heart of our partnership leading to the framework. Move on to the next slide, which describes the rapid evidence review of academic databases. So this was akin to a systematic search. We called this a rapid evidence review, but it was really quite comprehensive. We screened over 5,000 papers from searching 2 academic databases, and we focused on 2 key questions. So what is the evidence on positive or negative effects on nutrition and dietary outcomes from social protection programs in Latin America and the Caribbean? So as Giulia said, we were interested not only in the positive effects, but the potentially negative effects of programs as well. And then what pathways to impact are suggested or evidenced by studies of social protection and nutrition? So we were really interested in how was change happening. And we were interested in all parts of the life cycle, from pregnant mothers to adults, and most key forms of social assistance that are covered there in the box. And we were focused on malnutrition in all its forms, so undernutrition, overweight and obesity, and attendant non-communicable diseases, and micronutrient deficiencies. If you move on to the next slide, we see that there were publications across the region, so from Central America to Argentina and Chile, but a high concentration in particular countries where social protections have been well evaluated and running for some time, so including where you are there in Brazil and also Mexico. Now, on the next slide, we talk about the modes of impact. And as I mentioned, this was a key part of the study. So if you could move on to the next slide. And we were interested in not only whether there was an impact, as Will says, there have been some comprehensive systematic reviews recently that have indicated whether or not there's an overall impact when looking across meta-analysis of different programs. So we were interested not only in that, but how did change happen and what were the key implementation factors? More than that, we wanted to understand what was leading to potentially negative results, including, as we've mentioned, the risk of obesity and NTDs. So we found that change happens through multiple pathways, some obvious, including purchasing power changes, but some kind of known about, but sometimes neglected, including female bargaining power and empowerment. We found that context matters. So poor food and environments and a propensity of unhealthy foods can be a risk factor for obesity when purchasing power increases, for example, through a cash transfer, although the evidence in this area is still in its infancy. And again, as Will highlighted, implementation matters. It doesn't matter how good the design is on paper. Proper implementation requires constant monitoring and adaptation of programs as you go along. And that's particularly so when matters of equity and inclusion are concerned. So if we want to reach the most marginalized, then programs have to be tailored on the ground to their needs, including language barriers. So if you move on to the next slide, and this is my final slide before passing over to Carla. A key part of this, which I won't go into in too much detail, were the operational case studies. Now, we carried out over 50 interviews in 4 countries, Ecuador, Peru, Guatemala, and the Dominican Republic. Interviews with policymakers, with those concerned with operations and evaluation and research, to try to find out what were the key features, not only of design for social protection programs that are targeting nutrition, but thinking about some of those wider aspects of system resilience and systems interaction that Giulia was talking to as well. So very briefly, across the 4 countries, we find varying degrees of systemic capacity when looking at the social protection system as a whole. We see a range of systems from relatively strong national systems to several areas where there are room for improvements. Generally, in thinking about the double burden of malnutrition, stunting remains a focus across the programs, and there is as yet only limited attempts to incorporate other forms of malnutrition, including, for example, Peru focusing on anemia, and other countries only just starting to focus on overweight and obesity, even despite the huge burden across the continent that Giulia spoke to. And a range of other challenges exist in aligning programs and coordinating between implementing actors when considering those social protection systems really as systems. But despite these challenges, collectively, there's a range of helpful lessons from the case studies, from efforts to take more multi-dimensional approaches to poverty in assessment and inclusion of marginalized groups, to the benefits of strong national priorities for social assistance and social protection defined from the top of the political leadership, to a range of innovations around evaluation and results-based monitoring. So much more there in the study, and I hope that participants here will have time to read it. But now I'm going to hand over to Carla to discuss the frameworks which were the endpoint of all this work. So thank you, Carla. Over to you.
Mil gracias, Nick. Good morning to you all. And maybe to finish all the evidence that he showed, and the evidence process allowed us to the whole group to develop basically 2 landmarks of action. One that established some roots of impact to the decision makers of public policies, and another one that allows us to understand these action ways to the decision makers, programmed decision makers. I'm not going to talk a little much about that. It's very complex. So I'm not going to get deep on that, not detailed. But I want to highlight some points if you allow me. And I'm going to talk about basically of the action landmark focused in public policy. And I believe that here we can highlight 2 things. No matter the action landmark, these would be based in a system architecture that implies that our platform, our regulations, our system of planning and funding should allow to the programs of social protection adequate functioning. In this way, we have to base this programming in a series of knowledge and a learnership system that allow us to have capability. It doesn't matter if it's policy or programming, it should be a central point that base all of our decisions. On the other hand, and only to highlight, any social protection system should be based on analysis. All of our evidence showed that through countries' experience, there is a focus intervention line that's previous to the analysis. We are deciding how we are going to do things before understanding the situation where we are. This analysis not only has to focus on the system that affects the nutrition of the population, but in the interconnected systems. A person have consequences in their nutritional status, not only because of the consumption, but educative system that doesn't work, a health system that's not accessible, or in the same way to everyone, a social protection system that not have them, or a not safe job. So all the people that are design a social protection system has to deal with that. In this way, the analysis allow us to understand the panorama that exists so we can design a system that allowed us to measure the results considering the goals that we want. Social program needs to be designed with nutritional goals, so it will be possible to measure. You cannot design a program like that and the school feeding program without a nutritional goal and we wait for the results. That's not going to happen. Unfortunately, that's what our evidence showed. In this way, this analysis allowed us a decision system in a landmark of monitoring and evaluation that allow us to decide what kind of tools we can use. Transferences of species, transfers of resources, funding, and on the other hand, we have to understand very well how we want to affect the population, what kind of impact we want to see and to who. The families, the children in school are really the children under 2 years old, and what kind of benefits we can see in these families. Sometimes we see that impact is around the income and the active generation, but we see that there is a correlation with the increase of correlation, change of behavior, and the consumption that will change the nutritional pattern change. And finally, why we want to do that? Beside the results of medium and long term, that are results that are around in the children's case, in the educative, we want to reach a prevention of malnutrition in all the ways. As my colleague mentioned today and yesterday, we have a problem of a high complexity where population not only has to live in underfeeding and now live with the chronic disease as a result of an inadequate diet, and then transform the malnutrition in a long term do not allow us to be well and affects our capability to be productive. So our society decrease the vulnerability, being more strong to the shocks, what Giulia mentioned before. And to finish, and as a recommendation, what we have to consider, the evidence show that our status as a region and what kind of design we want to do. And I think that's very important here to highlight the focus should be a design of multi-sectorial design that has an impact route very clear. What we want to have based on evidence to make decisions not only has a focus of the cycle of light and adaptable to all that's happening, everything that we are living, so we can see where we want to get if the children's family or the children's themselves, 0 to 5. There is a landmark of monitoring and quantity and quality evaluation to see where we can improve during the program. What we saw that works very well, it's a mixing of tools. We saw through the evidence that just a way to benefit people, not optimize the results. So it's very important. So we have very clear that not only are the health system that affects the nutrition, but the feeding system and the protection, social protection system that would be used as platform to potentialize the outcomes. In this way, the way of action, the kind of transference should be adequate to the goals, because otherwise we cannot measure the results that we reach. And the documentation and the exchange of experiences that we see in platforms like this meeting here is very important, so all of your countries can learn from what we are doing. And I believe that the next step that we have to see with colleagues is the strength of our capability of action. How we want to arrive to have nutritional goals of on the population that we want. If you are saying that the school feeding program gives a health diet to a child, so we have to know, as in the end of the day, this child improve their nutritional status. Otherwise, we are just say empty words, because the nutritional status of the child do not change, the child's not more productive and not contribute to the country's development. So it's very important that us as the doers of that we have our capabilities, strength to contribute. And with that, I want to finish this presentation sharing a very short video of a program of social protection from Guatemala that approaches the encounter of vulnerable people to show the problem. I did not know about malnutrition when I started to receive help. But I enjoy when they come, and since then my son got better. An important local initiative supported by the UN program, door by door, to prevent malnutrition cases. Give advice to the carers. The first thing that weight, I realized that he was very skinny, and did not eat. In Guatemala, the
%1 of family, the nutrition brigade identified opportunities at 13 months. The government programs such as nutrition brigades offer health support in health, sanitation, and nutrition, identify nutrition and foreseen and make a prevention for the future children. Now I see what's happening. Ludwig is one of the 4,000 children that every month receive assistance for the nutrition brigades of Guatemala. These initiatives allow people to reach their maximum potential and our societies prosper.
And thank you, Giulia, Nick, and Carla for that excellent presentation, and then sharing that very impactful video with us. So we're now going to pass over to our commentators, and I'll start with Rodrigo. Te paso la palabra, por favor.
Muchas gracias. Nuevamente un gusto estar aquí en esta.
Thank you. It's a pleasure to be here with this panel and share the ideas of what was planted here. I work a work that brings a lot of evidence on the panel and some proposals. In the sense, I want to mention the proximity that I had with the work and the search of meta-analysis of information of studies that were done, but also to cases. Just to go back a little bit, bring the sense of the moment that we are now. Our conversation on social protection 12 years ago and nutrition were, and now here we see the evidences of how it developed. There was conversation and development of.
And on the other hand, the logic as it presents this work gives us direct sense of how is the social protection role. And we think as something in the public policy, in the social development, as education, health, and living. The social protection has as a goal to give the population a minimal level of well-being. And the first point of this level of well-being is to solve this feeding problem. And with that, the second component as a function of social protection is to allow the access of the rights exercise, not necessarily to deliver the product or the service of health and education, not to deliver the food, but give access to this health food to have the right to the nutritional and food and feeding safety that what bring us here. As a result, we could be productive or not. So in the world that we live, is the center of the discussion and is the link of to give this point that need to be developed. So that's put in evidence. And I remember some talks that I had 10, 12 years ago to us that work with that. We remember that we have a relation point with that. The point, it starts on the origin. The measurement to have the minimal resources to cover. To have the capability. It was defined the line of extreme poverty with the cost of the database in each country. When you talk about that, people that doesn't have the resources and dedicate all the resources to feeding. There is a surprise. People need to consume other things also in the analysis that we did recently about social classes that I myself developed in CIPAO, our work team. What we found is that the population in extreme poverty dedicate 38% of their research to the food consumption. Not reach, not consume everything, but just 38%. So what can we wait that the malnutrition be present? There's no another alternative that the malnutrition will be present. When I talk about the income, all the incomes, the work, the transferences, what arrives from another sources. So I want to show the sense of this relation, of this analysis, and beyond that, I want to show the relations of the analysis that we are not just talking about nutrition, but 12 years in the region, the theme of malnutrition and the double load. We do not consider this deficit of nutrients for a very simple reason, because there is no data. We just have systematics data that could be considered. We saw that in the cost of the double load of the nutrition, and we had the indicators not only because are the best one, but the micronutrients doesn't have any information on the system, and then to make policies that were presented. And I want to show you another element of a document that goes to be a proposal, where from the experiences of the results we can generate the characteristics to show the goals that should be accomplished and the necessity that exists that we have to satisfy, and the necessity that should exist to attain these goals. That's the evidence theme. To have information is something that comes for a long time, but not necessarily comes as a consequence. So to insist on that is important. Talks about the institutional restriction that we have in some countries, in the public policies. The public policy, we have deficits, institutional deficits, and one of that is to count on evidences of monitoring and evaluation with social registers that allow us to, in a model with interoperability of the data, make decisions with those evidences. So, as mentioned, in a multi-sectorial look, and of course the problems are multifactorials. We can, but we shouldn't, to attend well in a multi-dimension analysis in this dimension and work in a multi-sectorial way. The first part and the second one, it's evident, and the third part we talked about the intersectorial part. And there is a big problem, so the proposal that insists, show that exists, highlights this point and comes with an information. We are going to have a challenge of how we can advance. Has to do with the governance of our public policy, and then we have to insist in this role that has the role of feeding safety, and to see the theme of malnutrition with the different indicators that show different elements of the nutrition, and they're bound with the social protection policy that I insist. This document is presented not to all the actors and not evident to some actors in this social protection. I finish with two elements that I would like to highlight of interesting. One will be in what measure we can add. We talk about the resilience, in which way are tools of social protection that give resilience to the users. And it requires to attend those events of disasters. These blows that the pandemic showed. in a strong crisis. The public institutionality had to solve one problem, and now we have to attend the problems. All the epidemiological problems that stopped. So that is in our social protection institutionality, so the double resilience of people and institution to not leave the structural work and attend to emergency events even more. And maybe one element that we can add, the link to the offer of food goods, in which way the social protection that we focus on the population, how we can link to the producers' agents of food and link it to the productive process and the logic of the system and the articulation step. That's important, and I congratulate to you all. Thank you very much, Rodrigo. Very interesting, your comments. Now we are going to give the floor to Rui Lopes. There is a code. If you want to, you can use this code, QR code. Who you have the floor. Thank you very much. I greet you. Thank you for the World Food Program. Thank you for the invitation. I'd like to thank my colleague, the national responsible of the school feeding program. Yesterday, Francisco Meza had this vision. I'm in the health sector, very well represented in this forum, and I believe that this vision of who coordinates and makes this feeding program on a national level to request the World Program to invite Rui Lopes is important, that participate in this forum, and because since we started the government 5 years ago, we identified the necessity to coordinate a series of sectors to focus on the transformation of the agro sector. We would see very clear that the public policy directed to the malnutrition problems that have a huge impact in the health and also in the environment. And I can see that's one of the elements that we have to talk about in this program, the environment impact in the feeding system. And it has a huge impact on inequality and social justice. So we saw the necessity to work as a group, intersectorial group, so the public policies guided to the problems associated to malnutrition or poverty would be saw through this system look. So I thank you to the decision makers to the different sectors, and I also congratulate the initiative. I read the report, and I would like to see once more the study case that we will see in the next session, and I believe that the report is very good. I wish I would have that 4 years ago. I really like it. Congratulations. And I believe that's a tool that marks a change of paradigm. Sometimes it looks like that everyone, when you think the multidimensional should integrate the different programs in a social protection ecosystem, not only to evaluate the roots of impact, but to have that in multiple dimensions, to see the social protections on a pluridimensional way. we have negative impact, a lot of the problems of social protection, and to have this meeting in the different sectors turns evident the negative impacts for protection, social protection look, and I believe that on the document calls to the change of paradigm in the integration of all the sectors and the different programs of social protection that has the public policies. And also does that call to see the health problem and see the triple load. I like to talk about the necessity of see the data and the deficiency of some nutrients. It would be in the public policy designed to we need data, but the lack of that do not keep us from keep the focus besides the malnutrition and the overweight programs. So I like to call these programs directed to the social protection and malnutrition had this dimension, and so can have a paradigm change. I believe that we talked about that a lot of many years ago, but it's not on the social protection programs. And this concept to thinking about the double load implies that the social protection programs that was the trend during a long time. Let's find people that have malnutrition or group, and then direct in the program. And I see that this trend, I believe it's important to keep it and look for them, the need. But I believe that this perspective and this document shows that this program also is going to be directed to the whole population, and it needs to change. It needs to change the systems to solve the problem. And the social protection program and nutrition should approach in this way, in a holistic and systematic way, to have an impact on the data, not only on the decision makers. And I believe that this focus that has a program that drives us, and especially these pragmatical things, just conceptual marks, the definition of policies and operation of those policies, I believe that it transforms in something important to the dialogue between the sectors. I came from the academia, and now I'm as a decision maker. I feel that we have complicated dialogues because we do not put what's on the table. We gathering with the different sectors, but it's not clear this offer of dialogue. And I believe that these documents, the decision makers, to have these dialogues with other sectors to ensure that the social protection programs has this integrating view, multi-sectorial participation in all the components. And I believe that one of the things that I'm in the part of what approach can link and have clear with the health sector. I'm not saying that the health sector is asking to join or participation in social protection programs. And I believe that in the same health sector, we need to understand that the social protection is a fundamental part of this health attention. It's a whole component. There is no transformation of the health system centering the person, equal, universal, and if they not consider the social protection program. So they need to be, along with the public policy. It doesn't mean that they are not coordinating, but they should engage the programs so in its actions to fight and be seen as a great tool to fight that. So that should put on evidence and give us a perspective of integrated model in this primary healthcare system. So while I was reading the report, some elements that I believe that worth to improve, to use this mark. I thought about that yesterday. I didn't see in none of the programs of school feeding clear questioning to say the school environment is a disaster. Where children are is a disaster. It would be hard to think that the programs of social protection, of school feeding, not participating on that. So it seems like that these programs in nutrition would be two low impacts routes to give the minimal necessity delivered in the education parts, but there is a third blow point which to participate actively so they could be healthy. We cannot give feeding and education and allow that exist a huge offer of ultra processed and sweet beverage and modify people's income. So that's one of the elements that through this perspective could drive the food that imply much more than education to enter the regulatory fields to have a real impact. And another element that we miss in the multi-sectoral participation is the sector of the community component. Not only we are the government sector that need to be engaged on the definition and operation of the programs. That doesn't happen a lot in the discussion. We felt that on Mexico, sometimes the components thinking that the co-responsibility in the individual level is one of the mechanisms and the benefits of the programs. So you have to be engaged. That's going to the individual to do what we are asking you to do. So you cannot say you have to organize, demand these rights, do an evaluation, and then we have to demand. This is a very different perspective to request that co-responsibility transforms in the community organization that allows that the programs would be developed. So the programs should reach people. But not only that, but the definition of the tools. Sometimes the multisectoriality is understood by community. In Mexico, we saw that sometimes it is a hard work to the different sectors because we have goals. We put goals, and sometimes the goals, the multi-sector that decrease the speed that each sector has to develop their work. Decrease our rhythm of impact to favor this acting, and sometimes when we go to the territory are the same people because they receive different programs, different actions that make the public policies, and sometimes they realize the inconsistency of the programs. So to have partners in the community organization as a demand of rights, it's very important to the sectors to work in an integrated action with a centered approach in people. So I believe that that's one of the elements that's put on the document that allow us to take this dialogue and drive the impact routes, establish these 80 steps that are put in the operational part in a concrete action and wide action. The public policy really has this impact not only in the programs but in human capital. Thank you very much. Thank you very much, Rui. Not a round of comments. Very interesting. I'd like to suggest that you put your comments, your questions to the panel, please. I do not know if you received some, but while that happened, let's see. I will ask Carla and Giulia if is there any reaction. Yes, I thank for your comments, very important. I would like to highlight a point that we mentioned about the interaction that the social protection program has with the feeding and the perspectives that we started to see how we should have a concern in not damage the actions and programs. They do not contribute to the increase of the double load of the malnutrition. And the importance to focus on the availability of the food in the market, the link with the programs, a creation of demands in the point of view of the consumers that are benefits by the school feeding programs, including the school feeding. That's a point that we should highlight. Call my attention, as Rodrigo mentioned, people in extreme poverty use almost 40% of the income to buy food. That's is related to our transference program that show that poor people use their incomes to buy food. And considering the cost of good feeding, over $4 by person per day, and over 3 in the world, that put us to think what kind of feeding these people have. It's a feeding of low quality, so those people put their lives in the second plan because you ensure you're feeding immediately and the effect in a long term is terrible. And probably if this person is a child in school age, especially the small ones between 3 and 8 years, we know that the patterns of consumption of non-healthy feeding becomes permanent, and that's a lesson and seems to me very interesting. Another point that I saw that's interesting, and I would like to mention Rui and Rodrigo, was the data. The data, the evidence should be on the base of our design. And the evidence that we showed, we saw that we spoke about different languages. The same thing is not said the same way in the community of the nutrition versus the ones that make social protection and the communities that made school feeding. And this lack of translation between all of us that practices in the different sectors, it's a difficulty when we talk about programs and public policies. It becomes not only a difficulty, but a barrier of action, especially during an emergency, during a impact, a climate impact, economical crisis, those barriers make that our response to become not so quick. So the lack of language make our operational system be completely different and not operable between them. So we have a slow answer. It seems that have a multi-sectorial team working together from different perspectives makes this activity easier. Well, some questions. One question. Which are the best practices to an effective articulation in all the levels? And it seems important to me that we are thinking in all level, national, state. We talked about the community role that's so important when the services are delivered and seems important. The articulation between the levels to ensure that each level knows what to do, and that's done by a articulated way, not only vertical but horizontal. So I do not know it's a theme in the study or provokes any reaction, but I let that as an initial question. And our host made that. What did you find some regarding the results as in nutrition when it was used in a multi-sectoral way? So here I leave. So you want to say something? Regarding the regulation, the evidence showed that there were a lot of challenges regarding the articulation. So a point that we should approach, and Rodrigo mentioned a little bit in his comments, it's the governance versus capacity. There is a point where we have to go regarding a governance system that allows the articulation or do not allows that. And we saw that on the context, in a certain point, it would be a barrier because do not allows the articulation. And in the other hand, in the sense of articulation between the central level and territorial level, and then the community level, sometimes what happens in this process, or decrease what's here is a translation of the idea of the central level and an adaptation of certain territory. Sometimes this adaptation is related to the budget theme, the identity, the culture, including the lack of infrastructure or a favorable infrastructure. For example, in the school feeding, how is defined the school feeding? I don't know, in the central level, they would say, let's have 30% of a public purchase that will be fresh. There is no infrastructure that allows that. It's very hard to the local people to have this adequate system to accomplish this requirement on the central level because there's no structure or a funding support to pay the small producers because the small producers need to charge immediately is very sensible to the risk. So it's important that the finance systems exist. On the other hand, what you mentioned about the architecture, when all the school factors are presented in our study, we saw very well that when everything is articulated and the factors are integrated and we have a school feeding system design with the nutritional goal, it works. We know very well that evidence that was presented yesterday in the case studies that when was as programmers of public policy has in mind a clear objective, but we invest in all these articulation points and all these nodes of articulation, the nutritional goal arrives. For example, access to a diverse feeding, to have less anemia. If we focus to access to food, fruits and vegetables, and at the same time we do not have an access component like safe health water, because if these children eat all the vegetables, we'll have a lot of problems. We'll have problems to absorb all the nutrients. So if we don't have a health system to have vaccines, it's a problem. So it's very important that schools has an articulation platform to have a nutritional goal in common. I agree with your points, but also would like to mention that in the next session, they will analyze the experiences of the country. Those experiences showed that they had a lot of successful experiences about the governance, about the link between systems of social protection and health. Guatemala, this different territorial levels, and the decentralized model. So we'll have the opportunity to analyze through the direct experiences of the country, because as Rodrigo mentioned, there is a trajectory and experience of several decades in work in the systems here. So we could learn with the experiences, well, succeed, that could be improved even more. And I would like to say something regarding the coordination experiences, understanding the horizontal and vertical coordination between sectors and by levels of government, and show a little bit in Brazil's cases. For example, there is a public policy counselor where they present the design of public policies in different levels, and that's on the design. When the counselors stay in the level of design, do not go to operation, we got the coordination, not the operation. We can define that the articulation is the coordination that takes to the minimal implementation. The highest level of coordination, because the first level of coordination is to know what everyone does, and to see the contact points and another points to advance in the implementation. So the government sector is one thing, and another thing is the territory. The articulation on the territories, the evidence is the result. It's not like that. Let's stay with the good intention. In October, we have a conference of social development with the Ministry of Social Development. One of the points that we approach is the coordination and the models of coordination. And in the territory, one example of model of coordination would be the unique windows. The unique window of physical attent And it was so in many countries where the health services and educational services are central on those spaces. But when the articulation with other sectors, but yet they come from the social protection programs, support to the family, a unique window of offer in the homes. The support of the families will see if they, quote unquote, accomplish the conditions. Sometimes it are some restrictions and incentives regarding what you mentioned. That you do things, that you have better things. I came to offer the opportunity to have your right. And then at some moment we discussed.
The interoperability of the data is done through articulation, and in this sense, we do the due process and observing the breaches that they exist. So, or they don't have the tools to access. As we exchange our data, we share our power, because information is important, because in this interoperability we see the other as a space for benefit and the decision making, not only for everybody to share data, but so we can learn from each other. And a very quick comment on the different levels of government. There are aspects that were highlighted and maybe it's missing in the document. One of the big risks that we have in the protection system programs is that they become public policies for different groups, and that sometimes we don't have these governments and the programs become policy change units, and this is a risk of this vertical transition. But again, the territory and the community should require these programs, that they should not be political, that they've seen from the satisfaction of fulfillment of rights, the guarantee of rights that requires a normative, a law from general laws, so that this won't happen. Well, let's conclude. I have a final question for the World Bank. If I don't do, they will complain, and anybody can answer to that. What is the evidence on the responsibility and the link to the services to influence on nutrition systems of population with the focus on rights? I don't know if anybody wants to respond or make a comment or reflection. With regards to nutrition, that's what Rodrigo said. I think it's important when you say about conditionalities to understand clearly what is the reality that these populations really have. Sometimes, in the attempt to try to do a conditionality, we're telling the person exactly that they have to prove their poverty, their difficulty, to give them something. And sometimes when we talk about nutrition, it's very sensible to gender. We're dealing that the person who has more than one child goes to this health center without thinking about what happens to the other child. that they have to be attentive to all the vaccines, learn to do supplements, and be volunteer to contribute with other mothers. I think it's very important to think based on evidence on what happens to these families with this poverty status, and integrate these objectives, these nutritional objectives, through the analysis, so that we don't have to think about this type of conditionality that brings more heavy weight for these mothers of children of 5 years or younger. The conditional cash transfer programs generated the model for impact generation. From the 90s, it started as an evaluation that was disseminated in the region. And there were moments that we had discussions, particularly on what is the nutritional impact of this. And here maybe we have to differentiate what is the facility of the nutrition evidence and the food security, the access to food and consumption. We need to really evaluate the nutritional state that from this factor was generated, what conditionality generated or not. And then we have to think about it. But as we contribute with the access to food, what we have to think is the complementation, the nutrition, environment, the offer of food, how we are observing this nutritional insecurity that is present, and also in evidence. There are several studies that are systematized on different effects or impacts, and among them the economic benefit that brings to Brazil. There is a specific study on impact on the GDP, because part of the discussions with regards to the transfers that they are not incentivized the search for jobs or income generation. So it showed that this is a synergy in the search for new opportunities. Well, with this, let's close the session. I would like to thank all of our panelists who have for this great presentation. I would like to close now and finalize by saying a few aspects. The importance of thinking about nutrition in a very ample way, recognize different dimensions, also think about the different tools that we have available to reach not only school feeding but transfers as well, but the whole a continuation of tools that we can use, think in a more ample way. It's an agenda that is multi-sectoral, and talked a lot about this in the discussion, that it requires a very careful coordination and integration among services, programs, activities, and the different levels of actions that we approach, and also think in a broad way with regards to the drawing and delivering of what we have, thinking about all the different stages of the chain of delivery of services. Rodrigo, you mentioned a lot about the first stages, identifying the most vulnerable and needy people, but there's a whole chain that is important so that we can see the impacts that we need. We approach the theme of the data, the need to have an integration, articulation, the development of data system to approach the theme that it's very important. I would like to think also, because for us, for the bank, it's not only to have a conceptual benchmark or framework, but also to offer a guideline to the implementation of the benchmark for a country and for us. The bank think it's very useful for our own dialogues and programs, and therefore I'd like to ask you if you can come to the bank to make another presentation for our colleagues so that we can see all of this again. Thank you very much again, I think, and then we conclude. I give the floor back to Claudia. Thank you for all the panelists. Thank you. Please stand up for the picture of this panel. And in the meantime, I'll tell you some things. We're going to have a pause of 15 minutes. Hopefully, it only